Good morning. It's Dr. Soloway reporting live from a concealed office. I have more offices than anyone. I've got the mobile office in the car, I've got the office at the desk, and now I've got this concealed office. So, this discussion is going to be about NSAIDs and steroids. NSAIDs include everything from Feldine, Lodine, Relafin, Motrin, Ibuprofen, Advil, Aleve, Naproxen, Ketoprofen. Um, there's so many of them. There's 30 or 40 of them, I think. The first one was butazalazine. It was banned. It was wiping out bone marrows and killing people. Um, NSAIDs have become a staple of society. Uh, NSAIDs are used routinely for headaches. They're used for joint pain, so many other things. People take them like candy. Well, let me tell you the part you need to know. If you're over 50 or 60 years old, you really shouldn't be taking NSAIDs, and if you are, it should be a once or twice, or even two at a time, but not too often. The side effect profile of NSAIDs include, not limited to, but GI bleeds, hypertension, fluid retention, which leads to weight gain, leads to swollen legs, edema, venous stasis, kidney or renal insufficiency, kidney or renal failure. Um, there's a risk of, sorry, my eye itches. Maybe I need. Hold on, let me check this. Maybe I need Restasis eye drops. I don't know. Um, there's a bleeding risk. A lot of risks with NSAIDs in stomachs over 50 years old. The lining of the stomach will thin. People get atrophic gastritis. Um, People are at higher risk of H. pylori infections, which is a cause of ulcers. It's a bacteria that causes stomach ulcers. So now, with rheumatic diseases, over the last 25 years, we have biologic drugs. And because of the biologic drugs, people get better and they don't need to be desperate looking for and popping loads of NSAIDs. Um, the other thing I need to talk about here is the use of steroids, whether it's Medrol, methylprednisolone, prednisone, dexamethasone, you pick, it doesn't matter. They're ultimately all the same. Um, Steroids have an advantage of getting rid of inflammation almost immediately. You need the right dose and the right product. The side effect profile, while it's protein means it's everything. If you use the right dose for the right amount of time, generally the side effect profile is minimal. The most common thing would be irritability, poor sleep, elevated sugars. Now, if your A1C in a diabetic is less than 6, it's not going to raise your sugars. If your A1C is 14 or more, I'm not going to give you any steroid because looking at an M&M is going to make your sugar go up to 1,000. So, if used properly, they are perfect. They help everything. If you have poison ivy, take a week of steroids. It'll get everything gone. If you have lupus, rheumatoid arthritis, or an unspecified connective tissue disease, use of steroid may be very appropriate, and frankly, it is safer than steroid use. I'm sorry, it is safer than NSAID use. I don't think a lot of people in medicine will agree with what I'm saying, and that's because they're not forward thinkers. They read and take tainted literature and data, and they take it too literally. They really don't understand. Uh, I don't think there's anyone in the world who's seen more patients than I have in my 30-year career, averaging somewhere between 50 and 100 people a day. So I'd say I'd find it odd if you could find a doctor who's actually practiced in this field at a high level and has had more experience than me. So be very careful of NSAIDs if you're over 50. If you're under 50, it really doesn't matter. And the steroids, you have to be careful. I'm not trying to say they're candy, they're not. But if used properly, they're wonderful drugs. I hope you find this information useful heading into a big weekend. And for God's sakes, do not take NSAIDs if you're drinking a lot of alcohol. You're going to blow a hole in your stomach and you're going to wish you watched my video. Have a great day.